When I was born, I came out blue, and they knew there was something drastically wrong. And so right away, I was taken to Children's Hospital and stabilized.
I was born with congenital aortic stenosis. They monitored me until the point where I needed to have an angioplasty. When I was about 12 years old, 3 years ago, I was diagnosed with an aneurysm in the ascending aorta. Right now, I'm at a critical point. I'm at 5 centimeters, which is the time to open me back up and repair that.
I was told I had a murmur from birth, but not to worry about it. And so I kind of went through my whole life normal. And when I was in college, I had an echo and learned that I had a bicuspid aortic valve. I had ACHD and have had to kind of deal with the effects of that primarily as an adult.
Adult congenital heart disease is adults who are born with congenital heart defects. Most of these heart defects are picked up early in life, but some aren't picked up until they're adults.
This unique patient population have now made it into adulthood and have adult problems.
Many of our adolescents and young adults don't appreciate the residual problems their hearts may have because they're feeling fine. Some have been told by their physicians, you're doing well, you don't need ongoing cardiac care unless there's a problem. We've learned differently in the last 20 years. It's important for everybody who is born with a congenital heart disease and had a surgery to have at least one evaluation and surveillance in adulthood. Because very few of the lesions that we treat are cured. We can make the heart work better. We need regular surveillance to make sure that the heart isn't getting sick before the person gets symptoms.
An ACHD provider has typically a background in congenital cardiology, but then we've had additional training in what occurs when those pediatric patients become adults, because adults with congenital heart disease are not the same as children with congenital heart disease. They have all these other adult things that an adult cardiologist is not necessarily used to dealing with, but neither is a pediatric cardiologist. So the ACHD providers incorporate both of those aspects, and that would make them unique.
Over the last 3 decades, the congenital heart expertise has really grown here at Children's Colorado. There's just experts who all they do every day of the week is care for congenital heart patients.
My care started at Children's Hospital, obviously from birth. And then when I became a teen, there was this weird period of like, well, he's not really a child anymore, but he's a teenager. And so I ended up going to a different cardiologist. After looking at me and knowing what I had, and they said, we kind of recommend that the best care for you is going to be back at the Children's Hospital.
It's very different to be born with a defect, right? Now your lifestyle is just completely dependent upon that defect, as opposed to acquiring something later in life. So really, I don't even know if it was that much of a choice. Like, I feel like it was very serendipitous, but there are not adult congenital heart specialists out there, especially not a whole team of them working under the umbrella of a hospital.
We provide the full spectrum of healthcare for these patients, including everything from imaging studies, interventions, surgeries, and include all of the subspecialists that can help us out. So we work closely with the obstetricians and gynecologists, we work with neurologists, we work with a strong mental health team, trying to really provide full supportive care to our patients. I think we're still learning the role of mental health in cardiac health. If somebody is having challenges with their mental health, it affects how well they can take care of their cardiac health. And we know that if somebody has a lot of stuff going on with their heart right now, it's harder to maintain their mental health. So it goes back and forth, and we're learning that it's really important to take care of the whole patient. So we have fully integrated mental health into our cardiac care.
It's not just about the providers. It's more than that. There are nurses, there are coordinators, there are schedulers, there are social workers that either the only thing they do or the majority of what they do is ACHD. By the time you even come for your first visit, that ball is already rolling. That sets us apart, certainly from any other program in Colorado, and the vast majority of programs in the country, is just how large and comprehensive it is, not just with providers, but with the rest of the team.
Our goal really is to just provide the best care that we can for these patients. Sometimes it's better to have 5 or 10 heads thinking about somebody's case instead of just one. When we can turn to our colleagues and we discuss our complex cases together every other week, just to make sure that we're not missing something, and that when we go forward with surgery that we really have the best outcomes that we can, because we're anticipating everything that can possibly happen.
Our adult congenital cardiology program takes care of patients in adolescence and adulthood all the way through geriatrics, and we take care of patients where it's best to see them. The adult congenital program is housed on the Anschutz Medical Campus. We have Children's Hospital of Colorado, and we have University of Colorado Hospital, and really try to find the best medical home for each patient based on what other subspecialists they need to see and what kind of procedures and testing they may need done.
We were one of the first programs in the country to go through the accreditation process, which actually raised our care to levels that we didn't think we needed before we went through this process. And we are the only program in Colorado that's received that accreditation through the Adult Congenital Heart Association.
I was sort of getting regular both follow-up care and just the annual care. My valve had again worsened. Dr. Kana said I need to be thinking about surgery and recommended that I start looking at programs where I might want to get that done, and she recommended Children's Hospital to be able to choose a surgeon who both could do what my body needed and also is very well respected nationwide, and it's right here in my backyard. So it was an easy decision for me.
A lot of institutions, you feel like maybe you don't have immediate access to the doctors, kind of like they're untouchable. And at Children's, I just feel like I can talk to those guys like almost anytime through all of our web apps and all that kind of stuff right now. My chart, I'm able to have real-time conversations with Dr. K or whoever it is on the cardiology team, whether it's a quick prescription check-in or some kind of let's drill deeper on this question just about the way I feel. And everybody's really receptive to that. It gives me peace of mind.
Access to care for adults with congenital heart disease is very important to us. For over a decade, we've had outreach programs in multiple states to provide local access for our patients. When patients are unable to come, we're able to provide telehealth connections just to check in, to see how their blood pressure's doing, to see how they're feeling. Do we need to adjust their medications at all? Or are they doing well that we can continue intermittent surveillance? So this is a new technique and tool in our toolbox that we've learned to use and are continuing to evolve and figure out how it will best serve our population.
People tend to stay in care better if there actually is a formal transition program. I will see the full gamut of patients, but I focus mostly on transitioning those patients. So I have a lot of patients that I see from the strictly pediatric world, but getting them to get through adolescence and realizing that this is an important part of their lives. Starting around age 12 or so, we really want to start formalizing that a little bit, letting the parents know that this is that time that they need to start triggering them to ask more questions, to be more involved, having the patient realize that it's their responsibility to make sure that they take their medications, that they tell me what's going on, that they make their appointments. It's just that mentality of going from being a passive participant to actually being an active participant.
I think the transition period is really important, not only for the patient, but for the supporting staff, if you will, the parents and the siblings and things like that. I've got to give some credit to my mom, because when I was 12 or 13 or 14 years old and I had to have an appointment, she made me make the appointment. She had me call. It became the norm. And so that was one of the major things that she empowered me. Instead of doing everything for me, right, and protecting me, she supported me. And I think that was way more important for my long-term care.
If you compare patients who have complex congenital heart disease, our patients do significantly better than the national average. And that's the success of the procedure, how quickly they get out of the hospital, and how well they do in the long term. And for us, it gets back to that comfort level. We do many, many procedures. We are one of the highest volume centers in the country, which means we're very comfortable with the hardest, the toughest of the tough. When you're choosing an institution, you want to know that they are comfortable with all of it, and that's what we can provide here at Children's Hospital.
The Heart Institute takes assessment of outcomes and safety very seriously and is one of our top priorities. So the Heart Institute has been leading the country in transparency of outcomes. As long as any program has more than a 0% mortality, there's ways we can improve our care. And we've been learning in congenital heart disease, it's not all about mortality. It's also about their quality of life, both mentally and physically. It's important to have programs that are looking at newer therapies and providing the most cutting-edge therapies. So the background and investment in research are critical to improve care.
If you want the best care and you want the cutting-edge care, you have to come to a large academic center to get that. And that's one of the things that we do here on a day-to-day basis.
So now I am about 3 years out from my last surgery. And I mean, I will tell you, there are days that go by where I forget that I have a heart condition. I have a 5-year-old daughter. I'm coaching her soccer team. I am able to run around with her and play soccer myself. These things have allowed me to sort of get back to where I was before this really scary diagnosis that kind of, ruled my life for about 10 years and really prevented me from doing the things that I wanted to do. I don't feel that way anymore.
My condition my entire life, has just been a reality check, and it's been a guiding light for me. So I don't think that I have neglected to live any day to its fullest. One of my guiding lights always is to help others. I feel like I am so lucky to find Children's, so lucky to talk to you today, that really, the condition itself has been very motivating for me to be the best person that I possibly can be.
I've always wanted to be a firefighter. I think as a child, I was told for a long time, hey, probably not something you're gonna be able to do. But it was actually my driver. I wanted to do it. I wanted to show, if you're born with something, you can overcome that hurdle, right? You can do these things. When any citizen calls 911, they're expecting very top-notch level professionals showing up and mitigating their problem. Somehow, in 1981, when I was born, right, I got 4 doctors plus a whole myriad of support staff that their tones went off, similar to ours go off in the fire station, right? And said, we have a sick little kid, that's us. And they somehow assembled, they communicated well, and they came together to give me another chance, right? I can maybe bring that same type of flavor or level of professionalism to your everyday responses within the city of Fort Collins here. So that's really why I love doing what I'm doing. I mean, it's a way to give back in a way that somebody gave to me and my family.